Anyone who believes in indefinite growth on a physically finite planet is either mad or an economist.
We don't want to focus politics on a notion that involves the rejection of principles around which a large majority of our fellow citizens organize their lives.
We are not as endlessly manipulable and as predictable as you would think.
My starting point for this discussion is really that debate around ownership that is now part of the mainstream and the questioning about how organisations behave in a society where trust is challenged. And for those of you who are familiar with the Commission on Ownership and their report, they outline a philosophy of good ownership in organisations where they talk about a healthy market economy needing diverse ways in which ownership can express itself and be applied to varying business models, an ownership culture being developed that doesn't downgrade the long term and takes its responsibility for good stewardship really seriously. And finally, owners who will participate and engage in the strategies and behaviours of the companies they own. And one of the recommendations of the Ownership Commission was to extend foundation trust-style models of multi-stakeholder engagement, which is what we are, across the public sector. So the journey's been a really interesting journey of transformation at every level of organisations that were part of a command and control style of the delivery of public services through to organisations that are independent and have really interesting governance structures that I'm going to talk about. The first thing about getting foundation trust status really is that because it's no longer part of that command and control structure, it's about looking outwards to the communities around you rather than looking upwards to government. And it is a kind of autonomy and independence that's balanced by accountabilities and local engagement. And foundation trusts are a kind of hybrid mutual organisation. They're fully part of the NHS and they remain public providers, but they are a new model of public service delivery. They're public benefit corporations, and that means that the assets, i.e. the taxpayer interest in the investment in foundation trusts, is locked in. We are stewards of those assets, and we can utilise those assets, but we cannot sell them off unless we are clearly using the proceeds of those sales to plough back into the principal purpose, which is to serve the healthcare needs of NHS patients. We are authorised by a regulator, by Monitor, and we are accountable to that regulator. But this is a risk regulator, not a performance manager. And actually, our regulator has been a pretty good risk regulator over the years. And it means that if you are doing well, and if you are meeting the terms of your authorisation, they're really not interested in you at all. It's when you start to fail that they get interested in you and will intervene, and they have some pretty strict powers of intervention. Foundation trusts are entrepreneurial in nature, and they will be able to raise more funds through commercial activity going forward as a result of the new act that's just gone through Parliament. But in doing so, they have to reinvest in that principal purpose, which is to serve the needs of NHS patients. The governor's duties have grown over a period of time, and they've grown in relation to the freedom and independence that foundation trusts have been given. So the more freedom and independence that foundation trusts get from government control, the more responsibility has been given to governors to hold their boards accountable for the decisions they make. As a result of the act that's gone through Parliament, those duties have now been extended. They have a duty to hold, to hold the NEDs collectively to account. They've got a duty to represent the interests of members as a whole and the interests of the public in particular. They share responsibility with the board of directors in approving any constitutional changes, You now require 50% of the directors and the board to vote together to change the constitution. They have a role in the approval of major transactions and other significant transactions. Members and governors are clearly at the heart of what we do, and we've got, out of that 2 million members, we've got really large memberships in the University of Birmingham, for example. It's over 100,000, but the average size is around 15,000 members. Early on, Foundation Trust went for a kind of as many members as you could get, and what they're really interested in now is the depth of the engagement with their members rather than playing a numbers game. Some organisations are linking with local businesses. For example, Cumbria Partnership is holding health and wellbeing events at local business organisations and recruiting members there. They're leading on clinical innovation and efficiency. An example, medical technology, Salisbury FT, has set up a product which helps people who've got drop foot. It's a kind of neurological electrical product. They're now selling that worldwide, and all of the proceeds of that are coming back to be reinvested in the health of NHS patients. What I think we're becoming more interested in now is creating social value. So we're starting to measure the whole footprint and impact of the organisation on the community. We are probably the largest employers in most areas of the country. In most towns, the Foundation Trust will be the largest employer. Many FTs are working to reduce carbon emissions, introduce green travel initiatives, and so on. They're also working to develop sustainable food procurement and to source local labour. And so we have large budgets that can be deployed in a way that creates social value across the community. And many foundation trusts are enormously interested in doing that. They're also beginning to work in strategic partnership with local councils and universities. And the whole way in which we're using the organisational footprint and creating social value is about leading a long-term cultural shift within the whole organisational commitment to corporate responsibility in tackling the big issues of the day. And where we're going in the health service as a whole is that the old model of healthcare built around the acute hospital is clearly no longer adequate to meet patient needs. We have a growing elderly population, we have a new set of health issues that arise from lifestyle choices that people are making. People are living longer with long-term conditions, and they don't want to be in hospitals. They want their care to be delivered in other settings. You know, if we go on the way we're going without change, we will not be able to afford a health service in 20 to 30 years' time. And so we're facing massive challenges, and these couldn't be confronted and resolved in a command and control system. They can only be confronted by entrepreneurial organisations who are able to make changes in the patient pathway and radically change the services they offer to meet patient needs. And that's really what Foundation Trusts are looking to do.
What has been driven through Foundation Trust, the creation of Foundation Trusts, is started under the last government and very much adopted by the coalition government, is a direction of travel which we feel very comfortable with and feel it presents a model for the way in which public services can be developed for the future. I was very struck when we, in the early days of the coalition government, when we were undertaking a very rapid comprehensive spending review, one of the first things we did was to issue the public sector spending challenge, where we invited people working in the public sector to come up with ideas for how you could save money without damaging the quality of public services. And actually a huge number of people working in the public sector responded, over 60,000, with quite sort of sharp, practical, action-oriented suggestions, a lot of which were taken up and acted on. And what that said to me was that there are loads of people in the public sector motivated by the public service ethos who are frustrated frustrated because the system within which they work makes it really difficult for them to do their job and to give effect to their public service vocation, and particularly I think in the health and social care sectors, where people do have a very strong sense of vocation. That insight gave me renewed and enhanced enthusiasm for the mutuals agenda, because what it spoke of was a frustration, the sense that there were within the public sector, within the public services, a lot of very entrepreneurial leaders, actually. Not people who were about to become kind of red in tooth and claw financial and commercial entrepreneurs necessarily, although they might, but people had an entrepreneurial spirit who had an idea for how things could be done better, wanted to have the chance to give effect to those ideas. Pluralism, differentiation, the ability of the providers of public services to form themselves in different ways and provide different solutions is a good thing. And I don't think that's really a matter of contention anymore. Public services need radical and creative solutions, and that does mean breaking down the concentrated power of the state. And so I think there's a huge amount of synergy between the Foundation Trust movement and the mutuals movement, which we are driving. And I mind about this a lot because I think it can be transformative. It can transform the satisfaction that staff themselves have in the work that they do. It can drive progress. The first, we've seen last month actually, the first mutual spinning out of a foundation trust, around 50 staff in launch of Spiral Health in Blackpool, nurse-led 40-bed rehabilitation unit. It's a social enterprise. One of the interesting things with the mutuals coming out of the social care and healthcare sector is that most of them opt at the choice of the staff themselves to be a not-for-profit. So any surpluses they make, they will invest in the quality of the care that they provide, and the staff are involved. And of course joins a growing list of mutual success stories in the NHS. And I remember visiting a new mutual, soon to be set up mutual in Swindon, where the intermediate care operation in the PCT was joining up with the social care team in the from the Borough Council to create a kind of continuous sort of end-to-end care service. And going around the ward, I was taken by a nurse into the stockroom, and not as exciting as it might sound, and showed very proudly the rack of the wall of little racks of bits of kit. I mean, blood sets, hypodermics, all that. And someone had painstakingly gone around and put a sticker on each one with the price, the unit cost of each. And I said, well, who did that? I mean, it turned out it wasn't a manager, it was an ordinary member of staff. And I said, well, what's been the result of that? Well, they said, we waste a lot less, actually. We're much more careful with how we use the kit. So I said then, well, why are you doing this? Because you're a not-for-profit, you're not going to, if you save money, you're not going to benefit financially from this. And they said, well, two things actually. One is, in 4 years' time, we're going to have to recompete for the contract, and the more efficient we make ourselves, the better our chance of winning the contract again, and also of winning other contracts with other PCTs and commissioners in different places. So we're quite motivated by that. And the second thing is, every pound we save, we can put into improving the care, and that's making our job more satisfying. And what they will all say is we can hold our management to account. And I always remember when I went to the one in Swindon, I went with Charlie Mayfield, the chairman of John Lewis, and he said, talking to the staff, he said, a lot of managers will say, of course the staff don't work for me, I work for the staff, and he says normally rubbish. In a mutual it's true. he said, John Lewis, the staff can sack me. And actually in a mutual, that sense of the staff being able to hold the management to account, to get things done quickly, better, is very powerful. And so even if it is, as most of these, lots of these will be, not for profit, but there's no economic interest in the ownership the staff have in the operation. So we're doing a lot to support this. We have a very modest, in government terms, £10 million mutual support programme. We have a mutuals information service. Groups of public sector staff who are interested in this can get onto our mutuals information service, get some information. If they think they want to go ahead with it, they need some help of a modest kind, they can ask for some financial support. Legal, maybe commercial support. How do you build the business? How do you turn this operation into something that will feel like a business and be viable as a business? And we will support that. We will make sure that the advice that is bought by the mutual support program for those groups is then owned by us and made available to any new groups. So we're not kind of constantly, spending money with the same groups of advisors to provide the same advice over and over again. So we're giving support where we can. We're looking across central government at some of the biggest operational and transactional parts of government to see where there's scope for mutualisation. And this is, I think, a big part of the future.